Good afternoon, dear reviewers. I am Dr. Anuj Kumar Patel, and I'm a general laparoscopic surgeon presently practicing at TX hospitals. Today, we are going to have a awareness about gallstone disease and its complications. It could be a simple gallstone disease to a life-threatening complication arising from some of the problems neglected due to gallstone disease. So we'll first discuss about how the gallstones are formed, where are they formed, and how do they manifest, what are the symptoms and the signs, how do they present, how are they detected, and what is the treatment options for that, and what are the myths which are followed in general population. So first, coming to what is a gallstone disease. What is a gallbladder? Gallbladder is a small storage organ which is situated on the right lobe of the liver, somewhere over the right side of the abdomen, over the upper half of the abdomen, just below the liver. You can say that it is localized in the right hypochondrium. That's the terminology used for that. So what is a gallbladder? Gallbladder is nothing but it's a storage organ which has the storage capacity of 30 to 50 ml of storing bile. So generally bile is nothing but it's a juice which is produced by the liver, and through the ducts from the liver it gets stored in the gallbladder. So coming to the gallstone disease, because gallbladder is an organ which pumps the bile into the intestine. మనకి ఫుడ్ తినిన తర్వాత డైజెషన్ కావాలంటే ది బైల్ హ్యాస్ టు గో టు ద ఇంటెస్టైన్ అండ్ యాక్ట్ ఆన్ ద ఫుడ్ టు డైజెస్ట్. అయితే ఫుడ్ తినిన తర్వాత మన ఇంటెస్టైన్లో ఫుడ్ వెళ్ళిన తర్వాత ది గాల్ బ్లాడర్ కాంట్రాక్ట్స్ and the bile from the gallbladder is released into the intestine through different ducts. One is the cystic duct, which eventually joins the common bile duct and then into the intestine. So because of stasis or concentration of the bile in the gallbladder, or because of the motility disorders of the gallbladder, where the gallbladder cannot pump properly, there is stasis of bile inside the gallbladder, which predisposes to formation of gallbladder stones. Generally, what kind of stones? These are cholesterol stones, and because of some chemical changes in the components of the bile, this bile stone predisposes. Now coming to what are the patient's symptoms, what do patients present with? So patient generally comes down first primarily with a pain in the right hypochondrium or in the epigastrium. అయితే కామన్ వర్డ్స్లో చెప్పాలంటే ఇట్ కెన్ బి సమ్వేర్ అక్కడ మిడిల్ ఆఫ్ ది అబ్డమన్, లేకపోతే రైట్ జస్ట్ బిలో ద రిబ్స్ పెయిన్ రావచ్చు. ఇట్ కుడ్ బి a pain which is present at that place or a radiating pain. ఇక్కడ వచ్చి ఇక్కడ నుంచి రైట్ హైపోకాండ్రియం పెయిన్ లేకపోతే షోల్డర్ పెయిన్ కూడా రావచ్చు. Any of the particular things. Other non-specific symptoms the patient can present with dyspepsia, nausea, indigestion, but the first predominant complaint which the patient comes is a pain in the right hypochondrium or the epigastrium. So if this pain generally say patient comes down saying that I am having a pain of 30 minutes to 1 hour, they generally take a tablet after which the pain subsides. If the pain does not subside for say a whole day or 1 day or 2 day, we need to suspect that this particular problem has gone into a complication. That means that it was a simple gallbladder stone which has moved from the gallbladder, or it has got obstructed anywhere from its pathway from the gallbladder to the intestine. That could be common bile duct, that could be a cystic duct. Any of these places, if the stone gets impacted, this particular complication can happen. Even if it goes little bit down, it can cause gallstone pancreatitis also if it obstructs the pancreatic duct. So this is how the patient presents with. Now coming to what are the predisposing factors. Where do we see this gallbladder problem in? So there is genetic problem, okay, geographic problem, and certain other problems. So coming to the genetic problem, see, a patient can have a genetic issue. Next is a geographical issue. Geographical issue is we see gallbladder problem more prominent in North India when compared to South India. It is more prominent in North India along the basin of the Gangetic basin. It is more common. All the gallbladder problems and gallbladder malignancies are very high among Uttar Pradesh, Bihar, and West Bengal area. Next is pregnant ladies or breastfeeding ladies have more predisposition to develop gallbladder stones. Also, this is common in females. There is a dictum called as fatty, fertile in 40s and a female, more when compared to male. But male gallstones are also very common these days. There is a concept which is running these days wherein a person who has 120 kgs wants to lose weight to 70 kg with exercise or starvation. If the weight has been brought down, this can very severely predispose to the formation of gallbladder stones. Very rarely post bariatric surgery also gallbladder stones are seen, but the most common, as I've already mentioned, are the things. Now coming to how do we diagnose that? So diagnosis of a gallbladder stone, patient comes down with pain. A very simple test, we subject the patient to an ultrasound of the abdomen. Ultrasound of the abdomen is a very the basic test which is available in many of the organizations, where you can see a posterior acoustic shadow, you can see a gallbladder stone inside the gallbladder. So that gives a diagnosis of gallbladder stone. Now, when there are other tests also like MRCP, CT scan, which are done, if the patient has certain complication related to the gallbladder stone, like the patient has an acute cholecystitis, or the patient develops a cholelithiasis or obstructive jaundice. So this particular higher investigations can be planned later, but the basic investigation is ultrasonography. Now we will talk about the modality of treatment. So one should understand that there is difference between a renal colic, stones in the kidney, and the stones in the gallbladder. Gallbladder stones are produced in the gallbladder, and the treatment of choice or the gold standard treatment is removal of the gallbladder along with the stones, but not only the removal of the stone. Unlike renal stone disease, where we remove the stones from the renal tract or from the kidneys, here we have to remove the gallbladder along with the stone. So what is the ideal treatment of choice is a laparoscopic cholecystectomy. Laparoscopic ante oka chinna hole above the umbilicus and two small ports we put, and very small hole, it's a keyhole surgery through which the gallbladder is being removed out. Earlier this was done with the open technique. Now 95% of the times a laparoscopic cholecystectomy is sufficient enough for a chronic cholecystitis or a gallstone disease. Now we should also understand certain myths. People think that why a laparoscopy procedure is better than an open procedure. Open procedure law, there will be a cut right from the center of the abdomen to the right area. So the chances of infection of the wound, the chances of recovery and the post-operative pain is much higher in an open surgery than a laparoscopic surgery. The advantage of laparoscopic surgery is ఇవాళ సర్జరీ అయిపోతే రేపు మార్నింగ్ వరకు మీకు నార్మల్ ఫుడ్ స్టార్ట్ చేసి సాయంత్రం వరకు ఇంటికి పంపించవచ్చు. ఓపెన్ సర్జరీలో మీకు 5 to 7 days you have to be in the hospital. Along with that, open surgery will have more pain, post-operative analgesia is required for more amount of days. And other myth is whether there will be certain digestion issues after the surgery. So one should understand, after doing a laparoscopic cholecystectomy, or a lap chole is a simple term, the patient can go home on the second day and lead his normal life. After 1 week, he can do exercise, he can eat whatever he wants to, and he can do all his normal routine activities. So the take home message is, a gallstone disease, a simple gallstone disease, could also present with certain other complication as well, which other, with things has to be kept in the mind. So lap chole is a gold standard for chronic cholecystitis or a gallstone disease. Now we will talk about little bit about the complications what can arise. So as I told you, if the patient has a gallstone disease which is detected on ultrasonography, when the patient comes with pain in the right hypochondrium and it lasts for 30 to 40 minutes or 1 hour and it subsides after taking medicines, that patient is a patient who can get complicated. How the patient can get complicated if the patient doesn't undergo a surgical treatment. So the stone which is in the gallbladder can cause an obstruction of the duct which arises from the gallbladder, and that obstruction of the duct, it causes acute cholecystitis. Acute cholecystitis ante it is a miserable condition, it is a life threatening condition. Our time lo patient ki hospital admit ayin tarvata ICU lo we have to keep the patient in the ICU. We have to start on broad spectrum antibiotics, send his blood cultures and do symptomatic treatment. That happens when the stone gets impacted into the cystic duct. What can also happen in certain diabetic patients is that stone, if it is impacted inside the gallbladder, it can take off its capillaries, its blood supply. It can cause infection inside. Infection inside the gallbladder, it is called pyoceal of the gallbladder. Pus ఉంటాయి దానిపైన. ఆ పస్ ఎక్కువ ప్రెషర్ అయిన తర్వాత ఇట్ కెన్ ఆల్సో బర్స్ట్ ఆర్ ఇట్ కెన్ ఆల్సో రప్చర్. సో దాట్ సెప్టిక్ pus or the pus which is present inside the gallbladder, if it goes outside the gallbladder and it falls into the abdomen, then it becomes a life threatening miserable condition. This is number 2. Number 3 is some small stones can pass from the cystic duct and it can go inside the bigger ducts before joining the intestine, which is called as the CBD. Gallbladder నుంచి intestine వరకు వెళ్ళడానికి ఒక రూట్ ఉంటాయి. ఫస్ట్ ఇస్ అ సిస్టిక్ డక్ట్, నెక్స్ట్ ఇస్ అ కామన్ బైల్ డక్ట్, నెక్స్ట్ ఇస్ ద ఇంటెస్టైన్. ఆ కామన్ బైల్ డక్ట్లో స్మాల్ స్టోన్స్ అక్యుములేట్ అయ్యి ఇట్ క్యాన్ ఎవెన్చువలీ కట్ ది ఫ్లో ఆఫ్ ది బైల్ ఇన్ టు ద ఇంటెస్టైన్. ఆ కండిషన్కి మనకి అబ్స్ట్రక్టివ్ జాండిస్ కూడా రావచ్చు. అబ్స్ట్రక్టివ్ జాండిస్ అంటే ఈ స్టోన్స్ కలెక్ట్ అయ్యి ఇట్ విల్ నాట్ అలౌ ద బైల్ టు ఫ్లో డౌన్. బైల్ రివర్స్లో వెళ్ళి it will cause jaundice, it will cause cholangitis. These are all life threatening conditions which has to be treated accordingly. So these are all the complications of untreated gallstone disease. Other entity which is also a dangerous life threatening condition is gallstone pancreatitis. Manaki pancreas ఇంకొక organ ఉంటాయి which is very close to the gallbladder, and both the ducts of the pancreas and the gallbladder meet at a point. If the stone gets impacted at that particular point, it may also cause gallstone pancreatitis. Ante pancreas ki ubbinatayi, it can form an infection, it can form another life threatening condition. So all said and done, the take home message is, if a patient comes down with a simple complaint of right hypochondrium pain or central abdomen pain or nausea or indigestion issues or dyspepsia, it should not be taken lightly, and the patient has to undergo a ultrasound of the abdomen to detect the particular cause of it.